right. Good morning. Welcome to another edition of Issues and Interviews with Kieran Lalor on the Hudson Power Broker YouTube channel. Definitely, if you haven't subscribed to the YouTube channel, it's free. It takes 2 seconds. The more subscribers we have, the more people we can reach with our unique content. Nobody's covering Hudson Valley politics from a conservative perspective. And in most places, they're barely even covering politics. And this is important stuff. I have a great guest today, my colleague from the New York State Assembly, my neighbor from the New York State Assembly, the district that my guest, Kevin Byrne, represents, is immediately south of the 105th District. Welcome to the show, Kevin Byrne.
Thank you, Kieran. Thanks for having me.
Yeah, I'm happy to have you. And congratulations are in order because not too long ago you became a father. So don't talk too loudly and wake up the baby. Congratulations on the baby. How's that going?
Thank you. Oh, it's great. I mean, the year 2020 has been a bit of a nightmare for a lot of different reasons, but that is the shining light in my life that just makes everything in the world light up. Even if it's at 3 or 4 or 5 or 6 in the morning. So,
Yeah.
There's bags under my eyes. That's why. But, it's a crazy time to bring a child into this world, but we're still just grateful. He's healthy. He's great. So I'm very happy.
Braden, right? The boy's name is Braden?
Yes. Braden Vincent. So nice Irish, little Italian mix in there.
Very cool. Very cool. And how old is he?
He's 2 months.
2 months. Wow.
He was
okay.
born
It's going quick
right
for me.
Yeah. He was born right in the middle of this stuff, and my wife is a PA at the Bronx, so she was 38 weeks pregnant, working at Einstein Hospital with this virus all around her. So it's just a crazy, crazy time. And then if anyone that follows you, Kieran, and they're pregnant and they've been bringing someone into this world during this pandemic, specifically in April and May, it's an experience because your extended family is not allowed in the hospital. It's very, very different.
Yes.
So we're just happy everything's good.
All right. Congratulations. That's great. We just celebrated my oldest child's 14th birthday this weekend. So my wife and I were thinking a lot about our first months of having a child. It's definitely great, definitely challenging, definitely life-changing in a very positive way. So, and definitely leads to a lot of sleep deprivation. I'm glad you're a good husband. You're helping get up with the baby. Not one of those guys who just makes the mom get up and take care of the baby. You gotta both be all in.
Yeah. I will tell you full disclosure. Last night she got up more than me, a lot more than me because she
just lost some votes, dude. You just lost some votes. I don't know. Women are tuning out everywhere. Like, this guy made his wife get up. I can't believe that. No, I'm just kidding. You said, honey, I got a big interview in the morning, so I need to look my best and get some sleep.
She's a big Kieran supporter.
All right, good. She's a good lady. Let's move on to the topic. Over the weekend, I read a great op-ed in the New York Post, and I love to read an op-ed and then be like, I like this. This guy's singing my song here. And then I get to the bottom, and I know the guy who wrote it. And that was the case this weekend. You had a great op-ed on Cuomo and COVID and Trump. Tell us about it.
Yeah, sure. So, we've been talking about this coronavirus every day for so many months now. It's affected all of our lives. And, we've all become far too accustomed with the governor's daily press briefings. And I think in the beginning, earlier on in the pandemic, during the onset of the outbreak and throughout the worst of it, the governor he gained a lot of political capital in the Hudson Valley, in the state, and the nation, because he was largely being nonpartisan. He was even giving the president some credit where credit was due. The president brought the USN Comfort. The president brought the Army Corps of Engineers. The president brought PPE. He executed the Defense Production Act. He did all these things, and a lot of it was through communication with the governor. And at times, the governor gave him some credit and just thanked him publicly for it. But that's changed significantly now. Now that we flattened the curve. We have not overwhelmed the healthcare system. Certainly, it was stressed in the months of April and May, but we've done fairly well. We're living with a lot of restrictions still, even though the reinfection rate has been drastically reduced from where it was before. And he's singing a very different song now. The governor has gone all in on politics. He's politicized this virus. He's tweeting at the president. He's calling this a scandal, comparing it to Watergate, saying it's even worse than Watergate because people have died. But the crazy thing here is, it's the governor of this state, our state, Kieran, you and me. We represent this state. 32,000 people have died in this state. That's more than any other state in the nation. Now, certainly there's rises in infections and cases. And you look at the case numbers, there's a lot of different reasons why you have rises in cases. Part of that is testing. We saw that in New York. As we started testing more, you start getting other cases, particularly when there's a spread. But the thing you really want to look at is hospitalization rates, and you want to look at the deaths. And we have by far the largest number of deaths. And of those 32,000 deaths, 6,000 of them are in our nursing homes. And the governor does not have some perfect record here. I understand the virus was new. There's a lot of challenges. But for him to be throwing stones at the president while he's in his glass house, it's entirely inappropriate. He's partisan sniping from the governor. It's not helpful. Doesn't bring people together. And it's unfair because, there's a lot of times, and we were talking about this before the interview, where the president came, at a moment's notice. You bought the USN Comfort. It was not designed to be for COVID patients. The governor said we need it for COVID patients. You know what? They changed the federal regulations.
Yeah,
they made
right.
it for COVID patients. They wanted the Army Corps of Engineers to come in. We need the Army Corps of Engineers. We need ventilators. And we need 40,000 ventilators that, God bless, fortunately, we never had to use all of them. He brought us ventilators. He brought us PPE. He did all those things. So for the governor and anybody else to start screaming and say how unfair the president is, it's not accurate, and it's very forgetful. And you're seeing a different Cuomo now than you did 2 months ago. But for Kieran, you and me, this is someone we've dealt with. This really is not a surprise.
No doubt about it. And you're 100% right. Huge political element. I think he's doing two things with what I would view as projection. He covers up for his huge and deadly mistake and the huge body count in the nursing homes and elsewhere in New York State. And he also, win some favors with Democrats by hurting the president 3 months before the election. So very calculating. Now, he did come out with a report, and his report didn't say there was much of a problem with their decisions on nursing homes. 6,000 corpses tell us differently. And even when that was going on after they switched, he was still blaming the federal government. He said, we were just following the CDC guidelines or following the federal guidelines. Really,
Yeah.
why are very few other states following those same guidelines? And they could never point to these guidelines that they were apparently following. And then they switched, and they stopped following the federal guidelines when they abandoned the deadly policy of putting COVID patients back into nursing homes.
Yeah, so that's a really interesting point, Kieran. Thanks for bringing that up, because back in, I believe it was April, our colleague, Mr. Garbarino, and I, he's a candidate for Congress down in Long Island. We sent a letter to the chairman, Dick Gottfried, asking for public hearings into this matter. Then we did more information, and we did another letter as a conference pushing for public hearings. Many of us, including myself, have also called for an independent probe into this. But certainly as state legislators, one of the many things we actually do, majority, minority, Republican, Democrat, is we do public hearings. Sometimes they're just for show, but I mean, this is an actual legitimate purpose. We could have public hearings because the families of these coronavirus victims, the nursing home staff, the administrators, and heck, Department of Health thinks what they did was right. Them too. They can come, share their story. Let's get to the bottom of this. Let's get to the unvarnished truth as to what happened and how this spread. It was the governor himself back in February, March, and April who said that this virus, knowing what we knew from Washington State, it traveled through nursing homes like fire through dry grass. Right. So this was not some new phenomenon. We knew that this was a threat, and when we talk about the timeline, and you were mentioning it earlier about the March 25th order that came out. It was about maybe 4 or 5 weeks later, we were following this. It was after we did a letter. All of a sudden, mysteriously, the March 25th order just vanished from the Department of Health. Right. Just vanished. Fortunately, myself and many others already had copies of it saved. And then it was about another, several weeks, about 2 months after the order, the governor put out a new order. The Department of Health put out a new order telling the hospitals that they could not discharge positive COVID patients to nursing homes unless they were ruled out through testing. And when the secretary the governor's secretary, Melissa DeRosa, was asked about this, it was odd that the commissioner didn't speak up. She spoke up. They said, no, we're not repealing the order. We're just, it's the two orders coexist. I'm like, well, that makes no sense. They contradict each other. How can you have two orders that coexist when they contradict each other?
Yeah.
And I think that was just kind of covering tracks. And, that's fine. You make mistakes, you correct them. If things were that bad where we didn't have hospital beds and you needed to go as far as drastic to put positive COVID patients in the nursing homes, that's like an Armageddon scenario where you have to do that. We were not there. We had the Westchester County Center. We had the Javits Center. We had the COVID ship, the USN Comfort. There was beds available. We were nowhere near that scenario, and I think the governor just rushed to it. He was nervous. There was kind of a panic mode out there, and once they did it, they didn't want to roll it back right away. The CDC has said that they didn't put out guidelines that force nursing homes to take COVID positive patients, and they would not do that. So it's a big issue, and I'm hopeful that with public hearings we can at least shine a big mag light on this.
That would be great. Yeah, I noticed that you're up. You usually don't weigh in on federal, national issues, but this is really a defense of the White House and what the Trump administration has done in this pandemic. Kevin Byrne, you're the ranking member of the Health Committee. You have a healthcare background before you came to the Assembly, so you're a great person to talk about the healthcare aspects of this. What are you hearing about the economic aspects, specifically? Gyms thought they were going to be able to reopen a little while ago. They still can't open. The goalposts have been moved for restaurants. Now you can't serve a beer without also serving some French fries. How's that playing out in your district?
Oh, my district people are upset. I'm sure like everywhere else.
Yeah.
I would say there's definitely an economic impact. There's also a public health impact when you have people living in isolation, possibly living unsanitary lifestyles for an extended period of time. There's definitely a mental health aspect there's going to be consequences. And I would say you talk about the economic impact on our business community. It's substantial. The restaurants, anyone that makes their business based on people going into their doors, their storefronts. I mean, before all this, I feel like brick and mortar businesses were kind of in a tough spot because of the web.
Amazon.
Yeah, exactly. But this just made this is decimating them, and people can say what they want about the federal government's PPP loan, but that really just I feel like floated them a little bit. It kind of just delayed the hurt, but the hurt was always coming. It was mainly just a Band-Aid because I've talked to folks that were essential businesses. I hate doing rabbit ears, but essential. It's kind of a insulting term for folks who are supposedly non-essential, but an auto body shop in Patterson, not far from your district, Kieran. He was open, and I spoke to him in one of my little constituent Zoom forums, and I said, well, how did it go? And he goes, well, I stayed open. And he's like, Kevin, I should have stayed closed because of the lost revenue. There was less accidents, less work. He goes, it didn't make sense. I probably would have saved more by just staying closed. Wow. So the economic impact is real. It's hurtful. You mentioned the gyms. I mean, people just want answers. They want confidence. Well, if we're not in phase 4, when do we open? That's a fair question. They deserve an answer. And the schools is a big one.
Yes.
Talk about education in schools. Well, that affects our businesses. I mean, it affects everything. Right now, with the schools that are closed, you can see how people are unable to go to work. Right. You got teachers that are working from home, and it affects their spouses trying to work. They're trying to raise their kids. It affects everything. So if you're really going to fully reopen, I mean, the governor even mentioned this. This is why I like quoting the governor when I actually agree with him a little bit. Earlier on, he said, well, do we want to close the schools right away? Because once we do that, it's going to affect all the businesses, right?
Yeah.
It's going to be harmful to them. So he's acknowledged that. So, and the American Academy of Pediatricians have said, open up the schools. They want the schools open because there's learning deficits that are in our children that are not being tracked. I'm not trying, this is not a criticism of the teachers. It's just, their hands are tied. When you don't see students, it makes your job that much more difficult.
Yes.
And we're going to have children that are going to have a very difficult time catching up. And it affects our businesses. It affects our economy.
What do you think about the health aspects of children? Because you read a lot that says children don't seem to get the virus. They don't transmit it in very significant numbers. The fatalities are extraordinarily low for children 18 and under. Should that be an encouragement to open the schools?
I mean, I think you look at all factors. That's definitely going to be one of them. The governor talked earlier on. I mean, he's kind of dropped this, but he talked about, maybe when we shut everything down, maybe we should do something where we isolate and allow younger people to go out, and work. He's definitely shifted away from that, but it seemed at one point he was open to it. I'm not a doctor. I worked as an EMT. I have a master's degree in public administration where I concentrate in healthcare administration. I work for the Heart Association. I work for the largest private multi-specialty medical group in the state, which is Caramount Medical. So that's my background in healthcare. But certainly, I think that their risk from severe respiratory illness, being hospitalized, like those who have underlying health conditions and are the elderly, it's very different. There is some evidence out there that shows that they may have, there might be negative health effects after they resolve the virus, which the governor has talked about. Having a newborn child, I'll tell you, I'm sensitive to this. I'm careful to this. I don't want to bring something home to my baby. And then,
good point.
heck, so, and anytime I talk to people, I'll be like, be smart, be careful. I still wear a mask in public when I'm around other people. If I'm in close proximity to other people, I do it just because I want to be safe. Maybe it's being a little redundant. Maybe it's, not doing as much good as we thought, but I'm going to be safe about it. My mother works as a respiratory therapist. She, at Greenwich Hospital. It's actually one of the most dangerous jobs during COVID. Dentists, dental hygienists, respiratory therapists, because they work on your respiratory system.
Right.
She retired and put her papers in 2 weeks before my baby's due date because she wanted to be able to
take care of the baby. Yeah.
Yeah, because I don't want to get my mother sick either.
Right. Right.
So
that's amazing. Yeah, a lot to tangle with, and we'll be dealing with it later on today. We're going back to session, first July session of my 7.5 years in the New York State Assembly. I don't know. I've seen most of the legislation that's coming down the pike. I don't think it's gonna do too much favorable, but maybe we can push back on some of the bad stuff.
Well, if some of this anti-police legislation gets through, I mean, I should say more anti-police legislation gets through, it's going to be, I don't know how we repair it. It's awful. I mean, to try to limit, there's legislation out there, Kieran, that would limit NYPD officers from living in Putnam and Westchester counties.
I saw that.
It's insane. Try having an NYPD that functions. They can't afford to live in that city. Right. And quite frankly, none of them want to live in that city for the most part now. It's just too dangerous. It's absolutely insane the way these people are being demonized and shamed. The repeal of 50A was rushed through, and I was in meetings where, I saw our colleagues on the other side of the aisle make pretty strong commitments that they weren't going to touch that, and they reneged. And it's a shame because
the mobs in the street pressured them. We should never do anything. Even if it's a good idea, we should never do anything as a reaction to people being violent in the streets and looting and rioting, because it only encourages more. We should wait for a more sober time when things are calmed down. If there's good reforms to come out of it, we should never do it as an immediate reaction to the mob. All that does is make for more mob situations. Yeah.
Now, and you know what? How about this for food for thought? Why don't we listen to the experts in the field? If you're going to talk about that, why don't you have law enforcement at the table? I don't know. I seem to think they have some pretty good.
That's
insight.
A good point.
There's Bill, when they talk about defunding the police, they talk about taking them out of our school systems. I don't represent New York City. I do care about the kids, the people that live there. I don't want them to get hurt either. But I'll tell you right now, in Carmel, Mahopac, and in Westchester, northern Westchester, we like our school resource officers. Yeah. Right. They keep our schools safe. They're also there looking out for our kids. They're essentially a version of guidance counselors where they're detecting issues before they happen and are helping these kids. They get to know them growing up. I do not want them being taken out of our schools. And when they talk about defund the police, that's one of the things they're talking about, among many others. It's dangerous.
Good point. Good point. We're going to leave it right there. Assemblyman Kevin Byrne, keep up the good work. We'll keep talking. We'll keep fighting. Thanks so much for joining us this morning.
You got it, brother. Take care.
Take care.
Stay safe.
Good luck with the baby. You too.
Thank you.